This patient is injured from a car crash accident and is in need of first aid. The healthcare provider that arrives at the scene begins by first checking the surroundings and observing the responsiveness of the victim. She then proceeds to call emergency medical services and then wears a pair of gloves. It is very important to make sure that the patient has an open airway. We do this by checking for breathing sounds by using the ear. Next, we check for presence of a pulse using our fingers while simultaneously estimating the pulse pressure. To confirm breathing, use a stethoscope on the trachea. To get a more accurate assessment of the patient's blood pressure, we may use a sphygmomanometer. Lastly, we make sure the patient is warm and hold our hands on top of the area of pain to provide compression until the ambulance arrives. The surroundings are safe and we did wear personal protective equipment. The responsiveness of the patient is intact. We did contact emergency medical service. The airway is open of the patient. We checked the breathing rate and it was 28 breaths per minute. The circulation, we got the pulse rate as 120 and the blood pressure was low. It was 100/70. The skin condition is clammy and pale and moist. In conclusion, we see that the condition is unstable for the patient and we can conclude according to the vital signs that the patient has first degree hemorrhage, internal hemorrhage that is. Estimated blood loss is around 20% and our next actions should be to stop the bleeding and immediately transfer the patient to the hospital.
Sir, what's your name?
Rizwan.
Okay.
Where do you feel pain?
Okay.
Do you have any allergies?
When the patient arrives to the hospital, the medical staff begins a subjective examination of the patient by noting down his details, complaints, personal data, past illnesses, and allergies. First, we perform inspection. We check for bruising, surgical scars, hematomas, herniations, and any abnormalities. Then we perform palpation across all the abdominal zones. While performing palpation, we keep looking at the patient's face to check for signs of pain. The patient may be lying, so be careful. Then we perform percussion and check for dullness of sounds. And finally, we auscultate across different zones and listen for bowel sounds. Upon inspection, the patient's condition is severe because of bleeding. The Glasgow Coma Scale is measured at 13, which we can measure using the chart on the right-hand side. The patient looks according to their age, and their skin is pale, clammy, and moist. Their temperature is low. After performing further examination, using palpation techniques, pain can be found across all abdominal regions, and the muscles are rigid. Upon percussion, the liver and the spleen cannot be found and the sounds are dull, and upon auscultation techniques, no sounds are heard. The physician orders an abdominal ultrasound and CT scan of intra-abdominal organs such as liver and spleen. Lab diagnostics results are as follows. The red blood cell count is low, the hemoglobin is low, and the hematocrit is low. The treatment for this is blood transfusion for replenishment, infusion therapy, and for control of bleeding, we need surgery. The patient's body weight is 65 kilograms. So if we calculate the urine output as 1.5 milliliters per kilogram per hour, we get the total urine output for the entire day as 2340. We decide on administering 2400 milliliters of solution. We divide this by giving 500 milliliters of solution every 4 hours, and we further divide that by giving 250 milliliters of normal saline and 250 milliliters of lactated ginger. We decrease the quantity of the solution along the way to adjust fluid balance, and at the end we see that we have given 2400 milliliters of solution, which slightly exceeds our expected fluid requirements of 2340. Begin by applying a tourniquet and ask the patient to flex his arms. The artery is visible, so clean with a sterile solution first. Next, insert the needle into the brachial vein. And secure with a surgical tape. The patient has first-degree internal hemorrhage of the abdominal cavity, which is called hemoperitoneum. The physician orders an ABO blood test and an RH factor blood test. The results of the ABO blood test is the patient has blood group A and is RH positive. The patient's blood sample is taken from the fingertip and is added to the following antiserums: antiserum A, antiserum B, antiserum D, and a control sample. The antisera A and B will tell us about the patient's ABO blood type, and antiserum D will tell us about whether the patient is Rh positive or negative. The results are as follows. We observe agglutination in serums A and D, which means that the patient has blood group A positive. Begin by applying a tourniquet and ask the patient to flex his arms. The artery is visible, so clean with a sterile solution first. Next, insert the needle into the brachial vein and secure with a surgical tape.